Dr. Augustin with Bayside Chiropractic and Rehab, and today we'll be talking about low impact auto collisions, or what more commonly referred to as fender benders. To start, I'm going to give you an example of what we're talking about. So a lot of people have been through this situation. Let's just pretend we're stopped at a traffic light and we're just sitting there waiting for the light to change, and all of a sudden we get hit from behind. And the first thing that happens is we get aggravated, anxious, annoyed maybe, tense. That's what we call fight or flight. In other words, we're in a stressful situation. So the first thing we do is get out. And it wasn't a big accident. Let's, for example, say it was a 10-mile-an-hour accident. So there's not a lot of damage to the car. Maybe the fender is broken or dented, and there's some minor damage. And the police come, and the first thing somebody asks you is, how are you feeling? And you're stressed out. I'm fine. Let's just, get the insurance information, get done. And you're thinking about the car and how you're going to get to work. And later that evening, you get home and talking to your husband or your wife or your kid or somebody at home. And all of a sudden you're experiencing a light headache and maybe some neck pain. So the next morning you go to the urgent care or emergency room because you're still having headaches and neck pain. And the first thing they do is take an x-ray, and they come back and they say, well, we don't see, anything on the x-ray, so we think it's just a strain of the muscle. So they give you, the three most popular things: a muscle relaxant, an anti-inflammatory, and a painkiller. And, we've all been through that kind of situation. So we go home and we're told, it should be better in about 6 to 12 weeks. You should be totally fine. So you go home and you're told before you leave, if it's not better, it's starting to get better in a few weeks, go see a regular doctor. So a month goes on, and if you notice, well, you still have neck pain and headaches. You're taking the medication, which does help you sleep and does take away some of the pain, but you're really not getting better. So you go to the doctor and he says, well, let's just wait a little longer. And what happens is they might switch your anti-inflammatory, give you a different painkiller, and give you some more muscles relaxers, and then say it might take a few weeks longer. And then 3 months go by, and now, the medication, you don't want to take that anymore. You're having headaches, you can't sleep, it's causing you to be anxious, you're dazed because you're not getting sleep, and your neck pain seems to be getting worse. I know we've all been through this, and what I'm trying to get through, I'm going to try to show you that the case that you can't be hurt in these low impact collisions is false, and I'm going to try to make this case with some misconceptions that is out there. And one of the first misconceptions is that, well, there wasn't much damage to the car, so you couldn't have been hurt. Well, we have to remember that there's physics involved, and we weigh a lot less than the car that hit us. And I'm not going to get into physics, but through Newton's laws of motion, we have something known as inertia. And there's been plenty of studies that show that not only can you get injured at 10 miles, you can even get injured at collisions where the speed's less, the differential is less than 5 miles. And now there's studies going on that 3 to 5 mile an hour collisions can cause injuries. And this is all based on the main topic being the inertia of the body at rest versus the inertia of the car. And we've got to remember, when we're hit by a vehicle, doesn't weigh 100 pounds, it weighs thousands of pounds. So the speed isn't always the only factor. So the second misconception is, well, I didn't feel any pain at the site of the accident, so I couldn't have been hurt at the accident. Well, we know a couple of things from this, that just like when you first, sometimes swelling doesn't come real quick with these micro traumas or these small ligament tears or muscle tears. It can take hours, sometimes even days before symptoms develop. So we know in this case that just because you're not feeling something right after the accident doesn't mean you weren't hurt. And a good example of this is concussions. Concussions are very similar. They watch you for a long time because those symptoms can come on over days, even weeks. The third myth is that, well, I have a great headrest and, you know, the car's real safe, so I couldn't have gotten hurt. Well, we know that the seat and the actual headrest height, even though it does play some part in whether you get hurt or not, that the actual injury, when you're looking at the biophysics, and there's a whole line of research in just biomechanics, shows that the injury in these low impact collisions actually occurs within the first 1/1000th of a second. So faster than a blink of an eye. So really the headrest, the seat, doesn't have too much to do with it. Again, it has to do with inertia and laws of motion. Another misconception is that all it is a muscle strain. Well, I'm going to try to explain that if it were just a muscle strain, then technically most simple muscle strains will recover in 4 to 6 weeks. This doesn't explain people going on 6 to 12, 12 to 18, sometimes months, sometimes even a year later, they're still having problems getting worse. So that doesn't really explain these things. And studies have shown that people that have been hurt in these low impact collisions, 43% of them experience persistent symptoms that aren't explained by just muscle strains. Another myth is permanent injuries can never occur from these low impact collisions. Well, if we have something more than a muscle strain, then we know we probably have ligaments involved. You have these small ligaments at the back of called capsular ligaments, which we know with ligaments that ligaments are very difficult to heal, and if they become stretched, there's a tendency to get scar tissue in them, that they don't contract back to their original size. A good example would be an ankle sprain being a ligament injury. That people with ankle sprains, they have an incidence of reoccurrence a lot. Also, they have ongoing pain for months, years, a long time with osteoarthritis and degenerative joint disease later on occurring because of these types of injuries. So that's kind of a falsehood or a myth. Another falsehood is there were no objective signs at first, so you couldn't have been injured. Well, the problem is X-rays is the first thing we have done. X-rays are really only specific to bone type injuries. They give you some indications of spacing and dislocations and that, but these smaller injuries, you can't see soft tissue. So there is no way of saying, if there's not something seen on X-ray, that there isn't soft tissue damage. Now, MRIs are better, but sometimes just static MRIs where you're not showing flexion and extension or movement also have a problem of showing these types of injuries. Just because you can't see it on a test doesn't mean it's not there. No test is perfect. A good example again is concussions. Can't be seen on any test. The only thing you can go by is the person's symptoms and signs. And basically what they tell you through some types of questionnaires and those sorts of things. So very, what they would say, non-objective, more of a subjective. But we know how big of a deal of concussions have been now, especially with the NFL and major professional leagues having all the protocols for concussions, and the chance that these concussions can lead to more serious things later on. And there's no difference in these types of injuries. You can actually get a concussion from these low impact type collisions. Another example would be of a falsehood is, well, I had osteoarthritis or degenerative disc disease before I had the injury. So when I took the x-ray, it's all this previous thing that was in my neck that's causing the pain. It has nothing to do with the motor vehicle accident or the fender bender. Well, here's the problem. You can have degenerative joint disease and osteoarthritis, kind of, it's the same thing, but you can have this with very few symptoms. Then you get into these little accidents and your symptoms increase tenfold. Well, we can't say that your degenerative joint disease caused that, or it's all because of the degenerative joint disease. You also can't say that if you have something wrong with your neck already, that you have less of a chance of getting injured. I would tell people that you probably have more of a chance. If the neck already has problems, it's probably less stable. So if you're in your 50s or 40s and you have the osteoarthritis in your neck, don't you think you'd have more of a chance getting injured than an 18-year-old that's perfectly fit getting injured in the same accident? So that's a falsehood. And the one other one is that men and women are equally at risk for these injuries. Well, studies have shown that actually women out there, you are higher at risk. For some reason, women are higher at risk. In a 70 to 30% ratio, so about 70% more women, you know, there's a higher ratio of women that get injured in these types of low impact type accidents. So I hope I've kind of made a case that you can be hurt. Now, if you've been in this type of situation or know somebody that's having these problems that's been in this type of situation, don't hesitate to call me. I'd be more than happy to talk to you. If you have any questions, I love talking, so I'd be more than happy to take your phone call and get checked out. Again, I'm Dr. Christian Augustin with Bayside Chiropractic and Rehab. Be happy, be healthy, and our number is 251-990-8388. Thank you.